Welcome. This is our post-operative video from my patients that are getting their surgery and how do you prepare for your post-operative journey. Now your surgery is done. Congratulations. The worst is done. Now it's not that bad, you're gonna see, but also the psychological kind of anxiety is done. Now how do you prepare and what do you do after your surgery? Now within the first couple hours after your surgery, and for some patients they stay overnight, we have my excellent nursing team that's there to take care of you and we're managing everything for you. Now what do you do at home? Once you get at home with the person who's accompanying you, especially if you had general anesthesia, I want you to know that you could walk, but you have to walk slowly. And when you're at home, you have all these dressings on, all these bandages on. Now these bandages are there to protect the surgical area, but sometimes they could get soiled with some blood. Now what's normal and what's abnormal? A little bit of blood here and there is normal. However, if the dressing is soaking with the blood and it's dripping, that's not normal unless you have liposuction surgery. Now liposuction surgery is notorious to leak a lot in the first 24 hours. So you're going to be leaking a lot of blood and you may have to change your dressings every couple of hours, and that's within the norm. And we are there, me and my team, to serve you if you have any questions in the first couple of days and anytime you want after your surgery. Now, but for other surgeries, if you have any leaking of blood, you have to let us know as soon as you can so we could be able to counsel you of what's normal and what's not normal. Now let's talk about food at home in the first day. I want you to eat something very light. I want soups, I want something pureed, mashed. I don't want any heavy food that's going to make you vomit, like fried stuff. If you vomit, that's going to increase your pressures, and if you increase your pressures, you can have one of the clots dislodge, and that's going to create a new bleed. So we don't want that, just avoid that. Eating the next day, you can eat more normal depending on how you feel. But in the first week, I really want you to think about having a high protein diet. 3 days after surgery, you can start driving. Now, after surgery, you have some drugs in your body still, and you may be taking also some pain medications. Most of these surgeries are not so painful, but if they are painful, those pain medications are there for a reason. Take them, don't suffer, there's no need to suffer. However, they may cloud or change the judgment, so we don't want to drive and put you and others in danger. For those international and national patients who have to travel, please wait for the first 3 days at least. I usually see you at the post-operative visit just to give you that clearance to fly. So the first week I already alluded to a high protein diet. When we have surgery, we're in a catabolic state, so we're in a healing type of state. We want energy, and the protein is a good way for us to heal. So we want to have that 1 to 1.5 grams per kilogram of body weight per day. So we're talking about 50 to 70 grams of protein a day. So try to get that in your diet as much as you can, either with food or shakes. The first week after general anesthesia, I want you to think about no work. I want you to really take that time for yourself. This surgery is for you. This surgery is there to get you to where you want, but I want you to also know that it's not just that surgical day, it's the post-operative which is important. So I want you to relax. Take that day, that week to take it easy and take care of yourself. So you really want to sleep, relax, and not strain yourself mentally and physically. Now sleeping is important because we heal when we're sleeping. So I want you to think about and plan sleeping for at least 8 hours a day. You shouldn't wet your incisions in the first week unless we advise you you can. But when you come and see us at the 1 week mark, we'll give you that instructions, and no sex in the first week. I'm sorry guys, but that's our recommendation. At the 1 week, when I see you at my post-operative visit, usually it's 5 to 7 days after your visit, that visit's there to take off your dressings. Me and my team are there to serve you and to make sure there's no infections, because that's the time where we see that. And once we give you the okay, that's when we can take those showers. When I say shower, running water, no bath, no pool, no rivers, no lakes, no sea. It's just running water showers. Soap is okay. I usually prefer organic soaps or non-perfumed soaps or non-colored soaps. That's what I use at home. That's what I recommend for all my patients. It's less irritant for people. At the 1 week mark, it's also a good time to travel if you really want to travel. This is the time we're going to be giving you that okay to travel for my patients that are not coming from a national, international area. At 2 weeks, this is the time where I tell patients you could make love. What does that mean? Have sex, but light sex. We don't want anything crazy because anything crazy can increase the chances of the incisions opening up, and we don't want that. So something light, not to increase your heart rate by a lot. The incisions at this point should be solid enough to lift things that are a bit less heavy than 10 to 15 pounds. So for mommies out there, your babies, this is the time where you could be lifting them at the 2-week mark. For my eyelid and facelift patients, or any surgery where it's exposed to the public and you cannot hide it with clothes, the 2 weeks is when I tell you that's the time where most of the bruising and most of the swelling is gone, and people out there should not notice that you had the surgery to begin with. Now, for my tummy tuck patients, I tell you at the 2-week mark, that's when you can walk straight up, because for my tummy tuck patients, they're all walking a little bit hunched over because we don't want those incisions to ride up or even open up. And if you have drains, usually they come off at 1 to 2 weeks after surgery. At the 4-week mark, this is when I tell my patients where I did fat injection either in their face, either in their breast, or even a Brazilian butt lift or any other area. You don't want to be putting pressure on that area for 4 weeks. So for my Brazilian butt lift patients, this is when you could sit down, yay! But don't put any pressure in the area before that. At the 6-week point, sex, you could do anything you want, you can go crazy, and even at the gym, you could go crazy at that point, depending on how you're healing, because I will see you at the 6-week point to give you that okay before you do that. For my labiaplasty patients, you don't have sex any time before 6 weeks. Any sexual activity is at the 6-week point. Now, for my breast implant patients, we're going to be doing breast massages starting at 6 weeks, and we're going to be continuing those depending on how we're healing. So we're going to be doing that together. We're going to give you a better shape at that point. Sunblock, you have to be wearing your sunblock 2 weeks after surgery up to 6 months. So sun is everywhere around the globe. Even if there's not sunny and there's clouds, there's UV penetrating those clouds, and even penetrates your clothes. So I want you to put sunblock SPF of minimum 50 every 2 hours when you're outside on your incisions. Guess what? 1 year is your final result. I know 1 year sounds very far, but every day, every week, every month, you should be seeing improvements. I'm there for you, and my team is there for you to guide you. But it's usually that 1 year mark that signifies the final results. Except for my rhinoplasty patients, it takes up to 2 years for those final results. So congratulations, you've done your surgery and you're on your way for healing.